This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to answer the question, how do I know if I tore my ACL? Well, the first thing is, if you've torn your ACL, you're going to have a lot of knee pain. And when the ACL tears, it usually creates a lot of blood that goes inside the knee. So you're going to have a swollen and painful knee that's probably stiff for a bit. Now, what does the ACL do? The ACL prevents your tibia from moving forward on your femur. It also provides some rotational stability. So when you tear it, your knee might feel unstable, which is hard to describe except if you've already had that before. So if you're doing an activity where, and usually it involves jumping or some unanticipated movement, maybe you're playing soccer or basketball, something like that. If you're doing that activity, you hear a pop, your knee hurts, you have trouble walking and it's super swollen, then you could have torn your ACL. Now, the best thing to do then is you go to your doctor and have them examine you to confirm that. And if they do think you've torn your ACL, then it's worth getting your MRI to see it. So now that and let's say that you did tear your ACL, your doctor thinks you tore it, and you get an MRI and it shows it. The next question is, well, what do you do about it? So the first thing you need to do is do physical therapy to get your range of motion back. If you have an ACL reconstruction before you have your motion back, they don't do it as well. You don't do as well. But then the question is, do you need the ACL reconstruction? So there's more research on the ACL than pretty much any other orthopedic condition. And you have a lot of sports medicine orthopedic doctors, they love ACLs. They do ACLs all the time. They dream about ACLs. So you go to one of those guys, they'll probably tell you need it. Or a lot of them will. But the truth is, if you have full range of motion and your knee is stable, you don't really need an ACL reconstruction, especially if you're older. If you're on the younger side, it hurts, it's unstable, you want to get back to sports like football, soccer, basketball, then yeah, it makes sense. And there's also the thought of, well, we do the ACL reconstruction so you don't get arthritis later. But that is not necessarily shown to be proven true. The literature doesn't really support that. So you get it when you've torn it, you have an unstable knee, it hurts, and you can't get back to the activities you want to do. That's when you get your ACL reconstruction. But don't let anybody tell you, you tore your ACL, you need to get it reconstructed. It's a conversation you should have with your doctor. And you find someone that does a lot of them, and they'll do a good job for you, and you get back to the activities you used to do. So I hope that answered your questions. Hopefully you don't have an ACL tear if you're watching this video. Any questions, just leave them in the comments below, and I'll be happy to respond. If you like the content, you can subscribe to my videos. I try to release content regularly. And thanks for watching my video.